We did not have the opportunity to attach these documents, so I wanted to provide an opportunity for you to view these just momentarily and take an opportunity to see those in the forefront and access them so you desire. So in doing so, remember we talked about a number of resources in the presentation. We had apps, if you recall. We had these Sesame Street and calming and relaxation applications available. What I'd like to bring forward is the following, though. I reference quite a bit the NCTSN link for supporting children during the coronavirus. These are the talking points here laid out within their website that you can utilize. Remember, we talked about stating that there has been a lot of talk about corona. Tell me what you know for our tweens and teens. Here's a discussion about correct and inaccurate information and encouraging them to ask questions. And we can answer these as clearly as possible. Here's another example as well. And it's important to validate emotions that they're experiencing. We're asking how they're feeling and letting them know that this is really concerning, even frustrating for me as your parent or caregiver, but we're doing everything we can to protect ourselves. Help them self-regulate, getting into activities and being mindful and exercising. Remember, we mentioned yoga. And know some of the common reactions that we've discussed within the slide deck, as well as limiting that exposure to media and staying connected to those supportive people that we have, that we know, be it our friends or family, our colleagues or supervisor, or someone within your spiritual denomination if you so desire. Providing that reassurance and being a positive role model. And you may express worry and frustration as well and share some of your anxiety. But remember, it's important that they need ways, our children and our teens need ways of coping as well, and making sure that we're staying healthy. Remember those ABCs of self-care as well, being aware for ourselves and staying connected, and get that extra help should you desire as well. And here's an 800 number for you to access. If you remember, we talked about those things that the CDC also discussed as a way of managing those symptoms at home. We talked about covering your mouth and nose and washing your hands. Here's another way to check those symptoms of checking your temperature and make sure that you're getting rest and staying hydrated. And also, if someone does get sick, it's you create a room for them that's separate from the rest of the family members who are not ill. Making sure that you're notifying your healthcare provider as well, and avoiding sharing personal items with anyone that may be ill. They should have their own items that you're utilizing to feed them and care for them as well. Keeping all surfaces clean when you're coming back in the home and bringing groceries from the outside, and remember that hand washing that we discussed from Teaching Mama as well. You can access this information on cdc.gov/coronavirus, but these are 10 things you can do to manage your COVID symptoms. I also touched on going to the link that is on the slide deck that we have regarding accessing My Strength. We do have, remember, the map picture, and you click on your particular state. This is what we were referring to, and we all have different challenges that we're facing right now. And this is the mobile application that you can download. And as you see, it's one of the options it may give you is, how are you feeling today? You can have guided activities and discovering different things and talking to your inner voice and being mindful, being aware. And so this is the way that you can, for Texas specifically, that you can access that. If you go to that and sign up for it, you can complete your personal profile and take a part of that. So these are additional outlets that should be incorporated, or you can incorporate for your own personal support. And finally, what I would like to bring forward is a document that was created for mental health and coping strategies during the virus. This is a lot of information. Here's the CDC's website here once again, but here are ways that strongly to stress or crisis can occur. These are pre-existing medical conditions that can be exacerbated as well. Children with medical conditions we talked about, people who are helping with the response, our frontline workers, even those folks that are at the grocery stores or gas stations, and they're still out there working and helping us as well. Reactions, remember, want to pay close attention to the physical reactions, stomach ache, headaches, body aches, changing in our sleeping patterns and ability or lack thereof to concentrate. And remember that watching for alcohol use and other drugs. So here are additional things you can do to support yourself that we discussed as well. This was a sheet that, and I can share this with you if you'd like to contact us directly. I will give my email address at the end. This is a page that is about 7 pages long that we've incorporated with the resources that are found within the slide deck that was presented on talking to your children about coronavirus. It kind of gives you an understanding as well as what are quarantine and social distancing. What are those definitions? But we talk about that as well, and specifically for parents about how children react as well. And not everyone responds the same way. How you may respond to this trauma, I could be coping just fine and enjoying staying home. Other folks, we've heard that this is really a strain for many different reasons, being impacted by COVID for a family member, yourself, or loss of job, or gain of more responsibilities because other colleagues are ill, or family members that we may have to care for. So it could lead to excessive irritation and just avoidance of activities of the past, or more of something that may not be healthy that you're engaging in. Like eating or sleeping habits or substance abuse. So all of this we want to be aware of. So here are some more ways that you can support your child. I'm going to kind of run through these. Stigma, we touched on that lightly, but here are some following concerns that the CDC has here that you can help in discussing and enlightening your child as well as teens regarding avoiding placing stigmas. This was discussed initially, if you remember, when Corona first broke within the news of those folks who are experiencing stigma at this time. Communications with public health officials can help counter stigma during the COVID response. We want to raise this awareness as well and be cautious about the images that are shared. Make sure they do not reinforce those stereotypes as well. So be in tune to what your children are seeing and teens are seeing on Twitter, Instagram, and all those social media platforms as well. So here again, we want to reference the main page for COVID that is located also as well. So here are, if you remember, and you can check your slide deck, we have the resources available here for WHO, those Mythbusters, autism focused intervention resources from Affirm. This is really awesome for our children that are autistic, and assisting parents in supporting during these challenging and uncertain times. And here's a second one, as well as Teaching Mama for hand washing. You all may be the experts as well as finding other resources for hand washing. Remember, that's for 20 seconds. Here's a substance abuse for SAMHSA that you all can access, as well as the NCTSN. And the resources go on quite a bit. Again, we want to make sure we had a little something for everyone to access and to provide to your children during this time, as well as for yourselves. and maybe disperse some of these to your family members because they can be good talking points. And here's one at number 18, managing anxiety and stress. There's a PBS special that was done, why your mental health may be suffering as a result of the pandemic. Time magazine as well, the Child Mind Institute, and again referencing foster care and child care as well. That website would be very helpful. Again, it was our intent to make sure that you all had the available resources for you outside of the slide deck. So we want to thank you once again for allowing us to review those components of COVID, as well as examine those healthy behaviors that we should be putting in place and discuss those supportive ways with your children and your teens, keeping in mind those NCTSN talking points that kind of assist us through those steps. And we want to explore ways to manage stress and anxiety. Make sure you're exploring those. It may not, one thing may work today, that work, but tomorrow it may be something a little bit different. So just keep those in mind, and thank you so much for allowing us to spend this time with you and to provide this to you.